Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Today, talking about vaccines is Patty Malloy, Public Health Coordinator at Mahaska Health. She'll speak with us today about more rollouts and changes to the 1B classes. Thank you for joining us today. Patty, I wanted to just start from the beginning quick and quickly re-explain the classes of 1A, 1B, and 1C briefly, and then we can go into your updates that occurred this week.
Sure. Currently, Iowa and Mahaska County Public Health are in Phase 1A, which is our healthcare personnel, our residents and staff of long-term care facilities, nursing homes, skilled nursing facilities, assisted living facilities. The 1B phase is what we're looking to move into. We're hoping that on February 1st, that is what the state has given us guidance on. That will be persons age 75 and older, and then our law enforcement, government officials, first responders, firefighters, police, the pre-K to 12 school staff and earlyhood child education and child care workers, along with some other lists. And then down the road, Phase 1C details are to be determined.
Great. So 1B is that date we keep hearing about. Are you confident that February 1st will still hold true? That is the date it will occur.
We are meeting with or having calls weekly with the Iowa Department of Public Health Vaccination Bureau. That will happen this Friday as usual. And then we are hoping to gather more information on a date for the February 1st is what they have told us we would, be anticipating. So we're still waiting for the allocation amount, how much vaccine we're going to receive for that group 1B. And then we have our list of those schools and child care providers. We've been getting information from them. And then we will be giving out information to the general public for the 75 years and older when this also happens and take appointments for those openings.
You are actively going through lists and making calls of just who will need that vaccine. So you're getting the lists ready. Not only are you dealing with the logistics of that, but you're also dealing with the logistics of getting 2 vaccines or 2 doses out.
Currently, it's going well. We're in the 1A phase, which is the long-term care facilities. That's the Walgreens, CVS, and the community partner pharmacies. And we have seen in our community all our long-term cares. I think one was done this week, and then we have another one planned for Saturday. Again, that's not through local public health, but through the bigger corporate pharmacies. And across Iowa, they have taken on this role just because of the numbers of facilities in Iowa and to help us, in the smaller rural areas, get this vaccine out as fast as possible. So it is 2 doses. We have the Moderna is what we're seeing with our healthcare workers. And this week we have started doing the second dose. Christmas is when, just the week of Christmas is when the vaccine started being rolled out in Iowa. So that was, a little bit logistically exciting along with the holidays, but those went really well. And we're seeing the second dose being given, which is what we need to have that full immunity for the COVID virus.
A quick reminder, anyone who's questioning the need for the dose, regardless of age, but if any type of immunocompromised patient needs to continue to contact their primary care physician.
Yeah, currently as we go to the 1B phase, the 75 and older, if you have any questions or unsure whether you should receive it or not, we want you to contact your provider and get information from them. But if you're in a high-risk category, then it's likely that you do need to receive it just to avoid getting COVID.
The updates you're posting have been phenomenal, and impressed with your communication with the community. Tell me the best way the local community member, if they're having trouble or difficulty getting a hold of the information on when they can get scheduled, who they can call. Tell me about the best options that they have.
Yeah, currently, if you're looking for information for when the 1B rollout will start here in Mahaska County, look at the Mahaska County Public Health Facebook page. The Mahaska Alerts is also something that has been set up with Mahaska County Emergency Management. Mahaska Alerts give you the weather information and alerts of what's happening, but they've added a tab for Mahaska Public Health. The Mahaska alerts, you can sign up for those through mahaskahealth.org, the hospital website. When you open that page, you'll see a blue banner at the top and there's Mahaska alerts. Just click on that and it'll ask for your name and some information, your phone number, and you can get that information via a text, via a phone call, or an email. So those are some different options, and you can have multiple options if you want. So that's a great way that once we move on to the next phase and want people to, call us for appointments, it will be by appointment only. So we do want you to know that we are, reaching out to the different entities and organizations that will fall into that category. If you're 75 and older, just be patient with us. We aren't having lists for that yet. We want to set up appointments once we know how much of the vaccine we're going to be getting, how much we're allocated for the county, and then we'll set up the clinics by appointment just to manage the social distancing and be safe as possible. So again, Mahaska alerts through that mahaskahealth.org. You can also look at the Mahaska County Public Health Facebook page. It has the Mahaska alert on there, sign up, and also Mahaska County Emergency Management Facebook page has that Mahaska alert tab.
So just to recap, we went over the different classes again. You defined them. We went over where we're currently at, obviously, and still that key word is patience. We went over the best way to get that information. I'm so proud of how you have communicated again with the community. I'm so proud to work with you every day. Your knowledge on this is wonderful, and I'm very happy to be here to help share that message, Patty. So thank you.
Thank you.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.